One of our residents, Scarlett Johnson, myself, and one of our infectious disease specialists, Dr. Natasha Ching, we were noticing increasing numbers of children hospitalized with what we call disseminated cat scratch. So not what we had previously known as regular cat scratch disease, but a far more severe version that was spread further in the body. And when we started noticing that, we said, let's go back and look at our charts. Let's see how many children we've actually seen with this over the last 8 years and try to better understand what these children have and how we treated them.
So we conducted a chart review over an 8-year period of pediatric patients at Kapiolani Hospital to see if we could see an overall trend. What did people choose in their treatment? How long did they treat for? Can we characterize the illness anymore so that maybe it can be diagnosed sooner? How should we diagnose it? Because there's a variety of tests and imaging that you can use. Cat scratch disease is actually caused by a bacteria called Bartonella Hensley. It's generally something benign and self-resolving. Rarely it can be what we call disseminated, meaning it involves more than just the lymph nodes. It can actually be very serious.
We found that over an 8-year period, we actually had 18 children, 16 of whom were hospitalized for prolonged periods of time, where they had cat scratch involving their liver, their spleen, different parts of bone. 2 children had encephalitis, which is an inflammation of the brain, and 1 child had uveitis, which was inflammation of one of his eyes.
Say, hi, it's friendly. Hi, Fluffy. It's like Maggie.
So cat scratch disease is appropriately named. You get it from cats. Oftentimes kittens have a higher level of the bacteria, and it's spread between cats by fleas. So one way to hopefully prevent this and not get it is to make sure you're trying to control the flea population, especially with your cats, maybe avoiding wild cats, which oftentimes have higher flea incidence.
They're 3.5 times as high as what we've seen in a study that was done on the mainland that was actually published by the Centers for Disease Control.
I think we have a higher incidence of the bacteria in our kitten and cat population in Hawaii. Why exactly, I'm not quite sure. A lot of times you present with a prolonged fever, people get really nervous. They're doing a bunch of different workup trying to figure out what's going on, and that's a lot of tests. That's a longer stay in the hospital. So if we can get good diagnostic testing and we can start treatment earlier, maybe we can avoid some of the expense and emotional stress for families.